name is Sade Bradford Bond from Free Foster Care Books Incorporated, where we provide free books, of course, and resources to any member of the foster care community. So today's conversation is going to be so awesome. Our guest is Dr. John DeGarmo. I recently had a conversation with him about some pretty hot topic issues that's impacting the foster care community. Dr. John DeGarmo is an international foster care expert. He's a foster parent himself. He's fostered over 60 young people in his home. And of course, he is the author of the brand new book, The Little Book of Foster Care Wisdom. So check out our conversation, and I hope it gets you talking. All righty. Thank you so much for joining me today. I have such an awesome guest, Dr. John DeGarmo. We're going to be talking a little bit about COVID-19 and the impact that it's had on the foster care community. So just my first question I want to ask you, Dr. DeGarmo, what do you think is the biggest challenge that people in foster care in general are experiencing during this pandemic?
Oh, goodness. Lack of resources, lack of support. Right now, as these foster parents, as we are stuck at home, if you will, during social isolations or whatever it might be. And the children are also in the home. The children are not getting the support they need. They're not getting the therapy services they need, the counseling sessions they need. They're not getting those school services they need. They're not getting the one-on-one important visitations with their family members that they need. Their anxiety levels are skyrocketing through the roof. The foster parents who are caring for these children, not only are they worrying about, will I have food on my table? I still have a job, their own COVID concerns. They're thinking, well, how can I be a therapist for this child? How can I be a teacher for this child? How can I help this child through their own anxieties when they're feeling anxiety themselves? And foster parents are not getting the help they need from other people because, again, of that distancing, of that isolation. I always tell foster parents, you've got to create you've got to connect yourself to some sort of support group, because no one really understands the lifestyle of a foster parent unless it's another foster parent. It's a very unique lifestyle. So for foster parents' well-being and for issues of retention, we as foster parents have to surround ourselves with a support group. And much of that support group is gone right now because of this time we're living in right now. So it's a really hard time for foster parents.
That's interesting. And this question is a little bit of a personal question. Do you see the impact? Have you seen an impact in your own personal home along the lines of some of the things that you've discussed with foster parents?
Oh, sure. Everybody's feeling a sense of anxiety right now. Everybody's feeling a sense of stress level. The stress level is high for everybody right now. The anxiety level is high for everybody right now. I have 3 children myself who are much older, and they're in college, and their college lifestyle has been dramatically affected. And as a result, they're feeling different kinds of anxiety that they did a year ago when they were in college. So sure. And then my younger children who are going to school, the distance learning, if you will, it's hard on so many levels. My grave concern is this. I am far more worried and concerned about the mental health issues for children than I am of the virus itself.
Okay. In what ways?
Oh, goodness. Well, children, I'm reading so many studies right now and reports right now of young children, 4 and 5 and 6 years of age, who are afraid to hug their parents because they're told they could kill them. These children who are social distancing their toys apart because that's what they're being told. These children who are 4, 5, and 6 years of age who are already on antidepressants past year because of the anxiety levels they're going through. We now know that 1 out of 4 teenagers are thinking about suicide during this time of isolation. I believe this is going to be a crippling effect on the mental health issues of children. On top of that, so many children right now are sitting in front of the computer because they have to be at home. Sexual predators are aware of this. They're reaching out to even more children. Before COVID, we had 5 million children who experienced child abuse or domestic violence in their own home. Of course, this is going up as well during this time of isolation. So again, the mental health aspects for this, to me, are going to be felt for a long, long time.
Okay, so that's interesting because I have a 2-year-old son, and we have to pull him out of daycare because of the pandemic as well. And what I noticed with him is that he longs, now he's 2, but he really does long to be with other kids. We can go to the park, he wants to play. And then I sometimes, even as a mom, I feel bad because I have to pull him away and like, okay, you don't have your mask on. So I think when you're talking about the mental health implications, I think that it's having on young people, especially as young as 4 and 5, I can see it because even with my own little one, like I said, he really wants to play, and then he gets sad when he can't play with other kids.
Human contact is so important for young children. So important for young children. My wife is a doctor. She often tells me that we need, as human beings, 7 hugs a day for mental health. And, issues of trust, issues of attachment, issues of family, issues of so many of these issues these children are, again, going to be struggling with. Think about these young children, like your own son, 2 years of age. What kind of memories are being imprinted upon them right now during this critical time in their life? These formative years where children are learning issues of stay away from me, don't touch me. That's what's being imprinted on them during these formative years, and that may carry on for them for the rest of their life.
So when we talk about mental health, it's interesting because in my line of work, I work with a lot of child welfare professionals. And if we could pivot that conversation just slightly, I've heard that foster care agencies are having a lot of challenges with just retaining good quality staff. A lot of the staff that work at group homes, tend to be burnt out from what I hear from some of my colleagues. What do you think that foster care agencies can do to kind of help retain good quality staff, but not only focus on retention, but what do you think they can do to kind of help assist their staff as well?
You brought up a great point there. Before COVID, I often tell foster parents that caseworkers today, before COVID, were overworked, overwhelmed, under-resourced, under-supported, and underpaid. The lifestyle of a caseworker is so very, very challenging that few will ever understand it. Now, it's even more difficult for caseworkers. The foster care the process and the system is really slowed down in so many areas. I'm hearing from a lot of people, Dr. John, I'm really struggling right now as a foster parent. Again, the anxiety levels of the kids are going through my roof. I'm not getting the support I need from the caseworker. I can't get a hold of them. Caseworker is not answering the phone calls. Well, the caseworker is at home. Many of these caseworkers are at home. They're not able to go out as well. They're not able to give those foster parents that one-on-one support they need. So foster parents are quitting. And as a result, the anxiety levels and the stress levels of caseworkers right now are through the roof as well. Because how can they retain good foster parents during this time when foster parents are just quitting in numbers? So that's going to bring up the own stress level of these caseworkers. And I don't blame them for saying, I can't do this either. This is so hard. Right now, the court systems are understaffed. The foster care agencies are understaffed. I'm having agencies contact me on a daily basis. Dr. John, how can we help our foster parents? How can we help our caseworkers? How can we help our staff? Caseworkers need to continue to get the support that they need. They need to continue to get the services, the training that they need. They need to make sure that the caseworkers are safe from anything they might be concerned with. The caseworkers' mental health issues, they're struggling as well. They're struggling. Everybody is having a very, very hard time for this. And who suffers? The children suffer, the foster parents suffer, the agencies suffer.
So again, this brings me to an interesting point. So I've shared with you, I grew up in the Michigan foster care system, aged out when I was 18, and I am a woman of a particular age, right? Well into adulthood. What advice do you give young adults or just full-blown adults who have already experienced foster care? They already have families, like I mentioned, I have a 2-year-old son, have a husband. Like, what type of advice do you give those people who may not have as many types of permanent connections, but are still struggling during this pandemic? And this is the adult foster care alumni who has already aged out and they're living their life. They don't qualify for any type of federal services, primarily probably because of age, right? Again, I'm a woman of a particular age. What type of advice do you give to that person that is still having challenges during this pandemic in terms of mental health,
but may not have as many resources as, let's say, the traditional young person that's currently in foster care, or even the one that's aged out or maybe in a volunteer agreement? What do you say to those people like me?
Well, first of all, the woman of particular age, I think to myself, I must be a male of particular age as well. Just a couple years ago, I celebrated a very, very big birthday, so I must be around there too. Human relationships are essential. So for those people who have aged out, and their challenges are so difficult for those who age out. You and I know the numbers of youth when they do age out that drop out of school. We know the statistics of those who age out, who end up homeless, who end up incarcerated, who their children go on to the next generation. 2 to 3 have adopted a third generation foster care, which means their parents and grandparents were also in care and they never received the help that they needed. So first of all, listen, when my air conditioning breaks, I'm calling a professional because I can't fix it. When my car breaks, I'm calling a professional mechanic because I can't fix it. Sometimes when I'm broken, I've got to call a professional as well. There's nothing wrong with getting professional therapy, professional counseling. It doesn't mean you're a failure as a person. I think it's just the opposite. You are helping to care for yourself. So first of all, you need to begin to find out ways to care for yourself. When you don't do self-care, then you can't care for others. It's important to recognize that when you can't take care of yourself, how can you take care of others? So you need to surround yourself with people who can help you. Maybe those are professional therapists or counselors. Maybe if you're a person of faith, there may be a faith-based organization. A lot of faith-based organizations right now are recognizing that there is a foster care ministry, if you will, an outreach program, if you will. I often tell churches and faith-based groups, with 425,000 children in foster care, that means there's children in crisis, in need in every single community in our nation. And this is one way churches can help out by creating their own foster care program. Not only for the child and the foster parents, for the birth parents as well. So maybe there's faith-based organizations that you can care for. Research as well. Self-research, I think, is so important to learn how to care for yourself. There are lots of fantastic foster care alumni programs across the country that you might want to connect yourself to as well. I think those are just a few ways right there a few of the many ways you can take care of yourself, those who have aged out. I think of a number of wonderful people I know who were in the foster care program, who are now in their 40s, 50s, 60s, even 70s, who now reach out to those younger ones and act as mentors to those ones who are aging out. And that helps both ways as well, not only for the young child, but for the older one who aged out as well. So for those who are of a particular age, maybe helping somebody who was in the system that is no longer in the system, who's aged out, helping them can help ourselves as well.
Okay.
Listen, I've had 60 plus kids come to my own home. Every child's made me a better person in some way. I've learned so much from those children. So when we help others, we help ourselves too.
I appreciate that. So sounds like some of the big ticket items with the impact of COVID-19 on the foster care community is definitely mental health. I think you've kind of expounded on that tremendously. Outside of some of the things that we've already talked about today, is there anything else that you want to add to this conversation, or anything else that you feel like you want to discuss before we're done for today?
Yeah, thank you for asking. Two things. I want adults, parents, whether they're foster parents, whether they're grandparents, because kinship care is growing in numbers, and we know that the biggest kinship area are those grandparents, whether it's aunts and uncles, whether it's biological parents. You need to make sure during this time of COVID that we really are cognizant, that we are aware of the amount of hours that our children are spending online and what they are doing online. When these children who are learning at school, and they're spending all that time in front of the computer, are they actually doing all their work on the computer, or are they playing some type of game that can be very detrimental to them? Are they being introduced to new things that they shouldn't be seeing at such a young age? Are there predators who are reaching out and forming relationships with these children because the parents are focused on their own work or their own tasks they have going on? That's the first thing I would encourage people to do. Know what your children are doing online. Know who their contacts are. And the second thing I would recognize is this, that, even if I'm talking to those people right now who are not foster parents, even if you could never be a foster parent, and to me, it's been the hardest thing I've done, most important, rewarding thing I've done, but it's been tough. Even if you can't be a foster parent, as I said earlier, there's 425,000 children in the system, and there's 5 million plus children who are being abused or domestic violence in their home, this means there's an opportunity for you to help these children in some way, so many ways. Become a mentor for these children. Donate school supplies, donate backpacks filled with hygiene items, adopt a child during the holidays and help them with Christmas gifts. Be a transporter for those who are learning who are be aging out soon, to help them with job interviews or hospital visits. Donate cleaning supplies and household goods to those who have aged out recently. Those are just a few of the many ways that each of us can help children in foster care in some way.
You know what? I appreciate that. It sounds like what you're saying is that we might all not be able to do everything, but everybody can probably do something to pitch in and help the foster care community. Dr. John DeGarmo, I appreciate you so much for coming on today and having a conversation with me. And you are always welcome to come back.
Anytime.